Hi Rick, thanks again for taking the time to speak with me today about the threat that counterfeit medicines pose to unsuspecting patients.
Thanks, Aaron. I really appreciate the opportunity to talk about this grave and growing concern, especially as it affects the Hispanic community.
World Customs has recently told us that counterfeit medicines comprise a $200 billion underground economy, even more so than heroin and cocaine combined at $160 billion.
That's right, Aaron. And increasing access, affordability, and accessibility to prescription medications is one of the primary reasons we created the Univision Farmacia program in 2012.
Hoy en día todo es muy caro, en especial las medicinas. Siempre buscamos la forma de ahorrar.
Si me llegaba mi cheque, decía, ¿y qué voy a hacer? ¿Pagar la renta, pagar los biles o pagar las medicinas?
Providing that safe alternative in a legitimate pharmacy is so critical because patients who aren't aware of this danger are going to bodegas and botanicas where they can buy medicines they believe to be safe. They recognize the brands, but they don't realize the potential peril in purchasing medicines in a location like that.
And Aaron, when our program was created in 2012, we were clearly aware of the counterfeit issue and how it affected our community. And the Univision Farmacia prescription discount program is available in 49,000 pharmacies nationwide. It includes both brands and generics.
I think that's really important to emphasize to patients is that it's a wide range of prescription medicines across every therapeutic category, both branded and generic medications. As you think back on when you created this program and Univision was already aware of the threat that counterfeit medicines pose to patients,
we didn't know at the time that this issue was going to be as significant an issue as it is today. That said, our focus when we launched the program in 2012 was to bring affordable prescriptions to our community. At the same time, we wanted to make sure that they were safe, authentic, and went to legitimate locations. And with 49,000 pharmacias nationwide that accept the program, I believe the program has done that.
Because Univision really does speak to a huge audience in the United States, is this program limited to just Hispanic patients? And what does it cost to join?
The program is available to anyone who wants to apply. It is completely free and is available in English and in Spanish. You can apply in English at univisionfarmacia.com/en or in Spanish at univisionfarmacia.com/es.
What is the solution to this? How do we address this counterfeit drug problem?
You know, there's an old saying, it takes a village to raise a child. That's the concept we need.
Are we doing the adequate research? Are we doing the adequate education to law enforcement, to policymakers?
It's got to be more than just the enforcement arm. It's got to be more than just the responsibility on the schools. It's got to be more than just responsibility on Congress. We need input from private citizens, but we also need help from the pharmaceutical companies. We need help from the drugstores. We need help from the medical professionals.
Thanks again, Rick, to you and Univision for being a leader and creating a program that clearly enhances access, availability, and affordability for prescription medicines for millions of Americans.
Well, thank you, Aaron, for including us. Univision is committed to serving the Hispanic community. We're a mission-driven company, and Univision Farmacia is one of the ways in which we do that.
And that's the reason that Boehringer Ingelheim is proud to support the Univision Farmacia program.